So how do we know if a scar actually even needs treatment? The reason that somebody will come to you, it might be that they're in pain or they have problems with their scar, such as tingling, numbness, hypersensitivity, pain distant to the scar, like an abdominal scar connected with low back pain, or perhaps they've got a shoulder scar and headaches, or difficulty even moving the shoulder, difficulty in general range of motion. These are other factors that can all indicate that it would be good to treat this person. We can also visually assess the scars. We've got some lovely scars for you to have a little look at. I've drawn some circles on them. The general tone of the area looks good, like this person who's been photographed is in good physical shape. And they've got a great, tonus to their skin. On the left side of your screen, in the light blue, this scar is most likely from the removal of the appendix. And it looks as though there's a little bit of thickening there and even a little bit ropey. And the lower scar could be a C-section or hysterectomy scar. And it shows the variance in the fascial pool along the length of the scar. The area that's circled in yellow being pulled tighter and vacuumed, being pulled in towards the body, whereas the circles that are in green are barely visible, where the healing has just happened so incredibly well, and we can't even really see the scar very well. If you look super close, you can. There is also a purple circle, which may indicate where a drain or a port has been situated, which may tell us that one or more of these surgeries might have had some complications. Because we don't know this person, we haven't taken a client history, we don't actually know. But what we do know is that yellow circle there with that fascial pull that's very strongly getting pulled in there. It's quite likely that the circulation and the lymphatic flow are affected. And what happens is the creation of a dam, which slows down the flow of the circulation and the lymph. So when we're looking at this, the blue circle again, we can see the texture of that scar is quite different. The coloration is quite different throughout. And we can get an idea of, oh gosh, there's quite a lot happening there. And me looking at that, I think I could help this person to reduce the dam effect of that lower scar for sure, and potentially flatten out this whole area. Here's another one. So this scar is incredibly well healed. It's a C-section scar. And we can see the natural curve of the abdomen. This is a very modest curve to the abdomen. And I've heard some horrible words to describe the natural form of the abdomen there that gets pulled in by the C-section scar. So I've heard some horrible ones. Please remove from your vocabulary, fold, apron, overhang. Just remove those completely. Just delete. Even if you've never used them. Here we have fresher scar. So this scar is still healing. We can tell that by the coloration. And we can see that there's different parts of healing throughout this one scar. So at this end, we are more healed. And then we get in here. This part here is healed very nicely. And again, in this part here, very nicely. Still healing differently, possibly, sooner in the healing process. And then this part here is a different stage. And then this one is more like a stage 1, stage 2 part of healing. This little point in here, that's healed beautifully. And then this part here, that's back at that like stage 2 out of 4. Healing. So this is what I'm meaning when a scar can heal at different points. It's very common for C-section scars to have that, especially around about that 6 to 8 weeks when they're desperate to have their shoulders worked on, from lifting and carrying and feeding babies and toddlers and all the things. I would probably just be super conservative and just be like, you know what, you're healing really well. Let's just hang fire with that. I'll do some gorgeous neck, shoulder, back massage for you. So I would do something other than treating the scar for this particular person if they came in insisting that I worked on their scar. And I would tell them, just don't touch it. Just don't touch it, because my belief is that when people do self-massage, they are never, ever as light as what they should be when it comes to treating scars. It's the same with spiky balls and foam rollers. You've seen it time and time again. People just abuse themselves. So when it comes to self-massage and scars, I am not a huge fan of it. I don't like it. Let's see. So we've got another C-section scar here. And again, you can see that it's a little bit uneven and that there has been variance. So here we've got more of a fascial pull here. And then here, no. So we've got a dip here, like a valley, a deeper valley here. And then we've got a raised area. And then we can go right along the scar. This looks gorgeous, gorgeous, gorgeous. And then we get the impression that it could be a little bit even on the surface there. And then we have these 3 little circles here, don't we? Interesting, which are little dips within the scar there. And then this little area here. And it does go, there's a little bit here, a little bit here, a little bit here, which look a little bit like uneven, where we could definitely help and get that all going again, get that all nice and even, get the lymphatic and blood flow going in a really super gentle way. So hopefully that's been interesting for you guys, because I'm going to share with you now a case study. Okay, and I've got a little video for you to watch. Now, this case study is with a lady that we'll call Sally, and it demonstrates the power of language and how important it is to be very specific and careful about the language we use. Okay, so here is the wonderful Sally. Okay.
And I had a melanoma cut out in March.
Okay. From here?
From here.
Yeah.
Yeah.
And that was in March this year. Okay. And is it bothering you? How do you feel about your scar and like everything like that?
It's purple and it's ugly and it's probably, I think he cut muscle.
Oh, okay.
So it hurts a lot, and because he's in coughs, my surgeon's in coughs, I didn't get much after advice. And so when I went and had my stitches out here, they sort of said, well, don't kneel. I went, okay. And they said, don't stretch, don't bend, don't lunge, don't do. They said it's not healing very well at all. So they left the stitches in for another week because they said it's not healing well.
Okay.
And then they said, don't do anything with it. And I line dance, so I haven't gone line dancing since.
Okay,
so because they said don't. And so when I forget and do things, I can still feel it stretch or tear or pull or something.
Okay.
So I'm really careful.
Okay, so it's stopping you from doing your line dancing and from having fun. Oh, okay.
Which is my only form of exercise.
Okay, so you're deliberately not kneeling or bending?
I forget.
Okay.
I forget, yeah. So I'm doing it. I am now still. But every now and then you feel it stretch or pull or...
Any other scars? No?
Lots.
Lots?
12 on my face.
12 scars on the face.
2 on my shoulder, 1 on either shoulder blade, left and right. That was middle of last year.
Scars on your face. How do you feel about them?
Awful.
Awful. Oh, okay.
And I hate wearing makeup, which is probably why I had so much sun damage, because I hate wearing makeup.
Yeah.
One of the last ones actually went through my lip.
What's the...
Just how people look. If
looking?
They stare.
They stare? Okay. Staring.
To ask.
Yeah, cool. Cool. Yeah. Do you get headaches or any problems with breathing or anything like that?
Yep.
Yep. Any jaw pain?
Yep.
Yep.
On my face.
12 scars on my face.
Okay, so that's pretty interesting, isn't it? So when I met Sally, she was coming in just for the scar on her knee. I had no idea that she had 12 scars on her face. And we'll talk a little bit more about that in just a moment, okay? Okay, so this is an image of Sally's knee. Now, the affected knee is the one on the left of your screen, okay? Closest to the S in Sally, okay? It's slightly more swollen looking than the other, but she hasn't bent her knee in well over a year, almost 2 years. Yeah. So no wonder it's a little bit swollen, because we actually need movement to help our lymphatic system. So this is her scar. When I first saw this scar, had rain in my first reaction which is, huh? Yeah. So when we're scar therapists, we need to be super careful of how we use our language and our unspoken language of body language. Okay. What we didn't see in that clip that got edited out was that when I first asked Sally if she had any other scars, there's a big pause there that actually got edited out. And it was her, when I watched it back and read the body language properly, it was her looking at me like I had two heads. Like, hello, can't you see my scars? They're so obvious. I have 12 of them. And I was oblivious to that. Yeah. When I was filming the course, this is in our course. Okay. So I was concentrating on filming, treating. This is the first time I've met this person and the first time I've treated them. I'm trying to create a piece of educational material. I'm thinking about lighting and sound and all of these other things. And I missed it. So there is the importance of being incredibly present to our clients. Yeah. So we did treat Sally's scar on her knee and we did get a great result. The other thing we did was we treated the facial scars for Sally. And I've done a bit of a close-up here because her surgeon, what a talented person. And I don't go around slagging off surgeons, okay? I think that what they do is miraculous. From their perspective, they save people's lives. Yeah. Yes. Okay. Bedside manner might not be wonderful. We can do that. We can do the caring, nurturing. We want our surgeons to be very, very, this is the way we do it. I know exactly what I'm doing. I'm very certain about that. We need them to be like that. Okay. Society needs us to step into the nurturing, caring space. Okay. So this is Sally's. Lovely scars here. She's got some up near her eyebrow on the left, which is on the right side of your screen. And they're all tucked in around her laughter lines, around underneath those cheekbones. There's one that comes across from the right toward the center of the brow. They just look like normal lines on her face, but the effect, her reality, is so different than a person from the outside looking in. So I just find that fascinating. So we did treat Sally, and this is her reaction. Okay.
How they all feel.
Oh, wow.
Yeah.
Yeah. That's smooth. Gets to there and it's like, but I think that might be a thing. Oh, I'm so used to
bumpy.
Or not, feeling nothing.
Oh, feeling nothing. So you can actually feel your finger?
Yeah.
Oh, wow.
Yeah.
That's kind of cool.
It's still partly numb.
Yeah.
Yeah.
I mean,
but it's smooth.
Yeah.
It's flat. I'm so used to
the bump. Yeah, it looks different. It looks different. Yeah.
Wow, huh? Pretty cool. This just demonstrates what profound value is. How can we quantify the value of a person regaining the ability to feel their own face?